Ready?
Yep.
Yep.
Good evening. Unlike most people on Guam, we try to start things kind of on time. We're actually live streaming this, so we have to start on time. For those that are going to be joining us online instead of in person. So those who are joining us online, welcome. Those who are physically here, a double welcome for taking the time to come here tonight to join us for our Take Care Dinaña. It's I want to thank the staff of Take Care, Zhen, Giana, Azaria, Zarina, Ernest, and Nikki and Clarence for setting this thing up. I'm not going to say a lot because I know the food. I actually walked through the food line and said, "Oh, they probably went out of their way to prepare their buffet tonight. Looks better than normal." So again, this is an opportunity for us at Take Care to thank all of our providers for putting up with us during the year, putting up with all of our issues here and there, and then we just want to take this time to just really thank all of you guys for the services that you provide to our Take Care members. It means a lot to me. It means a lot to our members, and just to have this open communication, I think is so important. There's always going to be misunderstanding in this business. I tell my people that if we don't have any problems, that just means we don't have any business. So fortunately, we have a lot of problems, we have a lot of business, and this is one of the ways that we try to overcome that, to be able to meet you guys face to face and get to know you guys a little bit better and let you guys know who we are. Take Care is part of the Tan Holdings family, a company that has been in Guam for over 53 years. They're not going anywhere. I'm not going anywhere, hopefully. So having said that, again, thank you so much for coming. And before we kick off and let you guys go have that wonderful food that's been prepared for all of you, we'll have our Queen of the Prayer give the blessing for the table. Zhen.
Shall we all stand? Let's pray. Dear Heavenly Father, we thank you for this beautiful evening that you have graced us with. Thank you for these providers who have been so gracious to us and supporting our business, our members. We thank you for their patience and their kind understanding as we navigate through all these challenges that we have. Continue to bless them, continue to bless Take Care, and please bless the food they're about to eat. May this food give nourishment and strength to our bodies. In Jesus' name we pray. Amen. Amen.
Buffet line's open, so please go help yourself and enjoy the evening. We have a few presentations, but we'll let you guys eat first and get your stomach filled up before we start bombarding you with some of these presentations. You can let Donabel leave it up. She wants to stay up later, that's fine.
She's actually following us.
Okay.
The choice is a one.
No.
Instead of problem.
Jen can go up on the screen maybe after
Yes, you did. You did good.
You want to do that?
You did great. You did
Just so
great,
people
Mom.
know, like right after.
Because we already went through George's opening remarks. So.
Yeah. You're lucky I'm not taking it.
Well, that was great. That was like, oh my God. Where do they get their drinks? Self-serving drinks? Unlimited It's a buffet line.
What do you mean?
Where do they get their drinks? Self-serving drinks?
muted the mic. Not muted, but I lowered the volume. But
Thank you guys so much again for joining us for this evening. We're going to go ahead and get started with the presentations. How's the sound on the back side? Okay. Okay. Is this better? Is it my voice? Is this better? More? Okay. All right, so we'll just work on the projections. Anyways, so we're going to go ahead and get started with the presentations. So far, how's the food? I haven't made my plate yet. I'm looking for recommendations. Okay, wonderful. I'm glad. So now I'd like to introduce to you guys Mr. Jeremy Kelley from Code Blue Healthcare, and I'll let him take it away.
Thank you. I would like to start off by saying thank you to Take Care for having me out to present. Sorry. Get this mic a little louder. It's better. That's better. Right? You can hear me back there? Okay, good. As I was saying, thank you. Take Care for inviting me out to be the keynote speaker tonight. It's an honor. As they mentioned, my name is Jeremy Kelley. I'm the CEO of Code Blue Healthcare, and our mission is simple and clear. It's to drive accuracy, compliance, and financial stability for both providers and payers. And before I get too far into this, I've been restrained to a strict timeline, so if we could hold all the questions till at the very end. We do have a couple of trivia questions at the end, and I believe a couple of prizes. And advancing the slides tonight is my beautiful wife and Guam native, Janelle Santos Kelley. All right, so first and foremost, we understand how complex and constantly evolving the healthcare reimbursement landscape can be. It can be even more complicated here in the U.S. territories, treated differently, like rural providers, so to speak, as far as reimbursements concerned in the federal government's eyes, CMS. So today, I'm going to walk you through who we are, how we support our partners, and how our approach prevents denials, improves documentation, and strengthens financial outcomes for both sides of the claims process. Okay, so who are we? Code Blue Healthcare is a revenue cycle management and medical claims review company. We support hospitals, outpatient centers, private clinics, and payers nationwide. Our team includes billers, coders, nurses, nurse practitioners, physicians, all of which allow us to perform truly comprehensive reviews, especially for higher risk claim categories. This combination of clinical and billing expertise is a major reason we are successful at identifying documentation gaps and preventing avoidable denials. So, we look at the full clinical picture, and we provide real-time education and feedback to strengthen provider documentation and coding accuracy. So my background, actually the first job I took out of college 20 years ago was at CMS, at Medicare. So I was the national provider educator, rural health subject matter expert. So little did I know at the time that sometime down the line I would end up in, in an area much like the rural communities in the lower 48, underserved, and some of the complex issues that you face, and everything's comes at a premium. You have to import everything. You have staffing shortages, and some of the other nuances and caveats you have is being so remote geographically. So again, I was in provider education for a number of years. I traveled the country. Most specifically, went to the rural communities in the lower 48 and taught them how to bill Medicare, essentially. Just the ins and outs and ups and downs. So then I also was responsible for producing the education material that goes on the website under Provider Education. And then the last couple of years I was there, I took over the medical review department and redeterminations, which is the first level of appeals. And then I switched over to the provider side of things. So what we do, we offer a full suite of revenue integrity services that adapt to the needs of each client. That includes medical billing, coding, and insurance and patient collections. We provide prepay and post-pay medical review, clinical documentation integrity support, and utilization review. We also provide provider education and compliance training, which has been one of the most impactful services of reducing preventable denials. Our denials management team focuses on identifying root causes, not just appealing denials, but stopping them from reoccurring. This often amounts to education in the department of origin or workflow improvement. Coding audits, trend identification, and real-time provider education are what allow us to drive substantial improvements in reimbursement accuracy. Our standards and what sets Code Blue apart from others is our in-depth reviews. So typical review models are surface level, algorithm driven, and often reactive. Most rely heavily on automated edits or retrospective reviews, which identify issues only after a denial occurs. Our approach is different. We conduct deep clinical reviews combining documentation and coding. We proactively identify risks before a claim is submitted, and we also provide hands-on provider education to correct patterns that we see. So while the industry accepts a 10 to 15% error tolerance, our standard is under 3%. This level of accuracy is only possible because of our clinical expertise and proactive workflows. So as a comparison, some of the industry leaders, like when we compare ourselves to common competitive models such as Optum or Multiplan, the difference becomes even clearer. Our competitors, they rely heavily on automated reviews. These can be useful for flagging trends, but fall short when evaluating complex or high-risk claims that require clinical reasoning. Our team performs manual clinical reviews. This means a real clinical person evaluates each case. Our education model is high-touch and personalized. We also provide full transparency to both providers and payers, so everyone understands exactly why a claim did or did not meet the necessary criteria. Who do we serve? So we work with a wide range of healthcare organizations, both on the provider and the payer side of things. So that's outpatient wound care, limb preservation centers, home health agencies, acute hospitals, post-acute facilities, anesthesia providers, surgery centers, and as insurance plans to take care. Our partnerships include providers in Texas, Oklahoma, Colorado, Idaho, Tennessee, Guam, and American Samoa. These relationships have given us insights into regional payer trends, documentation challenges, and especially specific risk areas, allowing us to continuously refine our approach and provide relevant education to each provider we support. The value we provide to providers and payers. Our value proposition is designed to support both sides, providers and payers. For providers, we streamline the reimbursement process, offer documentation support, and reduce coding mistakes. When documentation improves, reimbursement improves, and subsequent audits become less likely or frequent. So for payers, we reduce improper payments, strengthen compliance, and reduce rework. So I'm going to take a look at some of the high-risk claim categories. These are areas where errors, overpayments, and denials occur most often. That's the room and board charge, pharmacy, IV therapy, radiology, anesthesia, therapy services, evaluation and management services, and prior authorizations, to name a few. These carry high denial risk due to documentation requirements, modifier use, or medical necessity concerns. Key reminder, and I know that an education piece went out, an email blast, and it's on the website, but this pertains to prior authorizations. The reminder is extremely important that prior authorization is not a guarantee of payment. Even with an approved authorization, claims may still be denied if medical necessity is not clearly documented or if the billed services do not match the authorization approval. Providers must closely follow payer-defined documentation requirements. When teams understand that prior auth is permission and not confirmation, we see a significant reduction in preventable denials and costly appeals. Evaluation and management, risk areas. We all know E&Ms historically have been a major source of errors, upcoding usually. But the biggest risks include unsupported levels due to insufficient documentation, incorrect use of time-based coding, improper or missing modifiers, and that list goes on. These errors not only lead to denials, but also create compliance concerns. Our team works directly with providers to ensure documentation supports the selected levels and that modifiers are used correctly and compliantly. Notably, the E&M guidelines did change recently, and it's moved away from the primary focus time-based guidelines to problem-focused, diagnosis-driven, systems diagnosed. So it's good that they got away from, clocking time. It's about the time you spend with the patient more so now. Some of the common coding errors that we see, coding and charging pitfalls, rather, incorrect E&M leveling, mismatches between diagnoses and procedures, unbundling of services that should be inclusive, missing or incorrect modifiers, and documentation gaps that cause downcoding. The 25 and 59 modifier are prime examples of that, most commonly misused modifiers. So our audits, they actually pinpoint these trends, and then we deliver specially specific education and tools that help correct the issue immediately and prevent reoccurrence. So how do we help? Our strength lies in our end-to-end approach. It all starts with the remit. I can track the financial health of the institution back to the remittance advice or the EOBs. Even where the Department of Origin, where the error occurred. So we conduct targeted claim reviews to stop revenue leakage. We then provide individualized provider education. This may include checklists, templates, quick reference guides, or workflow tools. These materials help standardize documentation and establish consistency. And then we back this with data-driven reporting that clearly highlights trends, risks, and opportunities. Finally, ongoing monitoring ensures that improvements are sustained and that repeat errors are eliminated. Oh, I'm making pretty good time. So we're in closing. So again, in closing, to recap, our goal is simple. We want to help organizations produce cleaner claims, reduce denials, and strengthen financial health, whether that be on the payer side or the provider side, by combining clinical expertise, coding accuracy, proactive reviews, and high-touch provider education. Code Blue Healthcare delivers measurable improvements in reimbursement integrity and operational efficiency. And again, that last slide is Q&A, but that's moved to the end. And we have a QR code at the end of this presentation if you have questions that you wish to submit, or just not anything in general, but I mean, pertaining to what we do, or how that could affect your practice or your processes, or how your processes could be improved. Just take down the QR code. So, get 2 trivia questions. And Zhen, you're gonna help with the hands. You're gonna whoever raises their hand first with the right answer will get the prize. So the first one's easy. It's true or false. A prior authorization guarantees that a claim will get paid. I didn't have any other questions loaded up. I saw your hand first, I think.
Oh my gosh. Oh no. Who did you see first? You tell me.
You're gonna get me beat up. Yeah. Correct. False. Pick a prize. Yeah. Okay. Trivia. You ready?
Okay, second question, right?
Yeah. Question number 2. This is multiple choice. Missing or incorrect modifiers can lead to A, clean claims.
Sorry, Miss Waddell. Sorry.
B, faster payment. C, denials or downcoding. Or D, a free lunch. Oh, we have a winner.
Thank you.
All right. That concludes my portion of the presentation. I do appreciate everybody's time and bearing with me while I move through the information, and I'll be over here. You want to just, afterwards, you want to come say hi or whatever? We'll be here. But thank you.
Improving member health. Adjust that volume. Oh, see? Okay, so improving member health, engagement, and outcomes. And this is me. My name is Giana Santos. I am the health educator and nutrition counselor with the Take Care Wellness team. And on the backside, we have our wellness team lead, the true heart of the wellness team, Ernest Aquino. Okay, so we'll be discussing tonight our offered programs, the participation and outcomes, eligibility requirements. Then we'll go over a quick little video for scheduling and the referral process, and what will be up and coming for the year 2026. So our most popular program at this time is our Diabetes Self-Management Education and Support Program, or DSMES program. This has been a really great curriculum for those with type 2 diabetes, with type 1 diabetes, and we even have a few members with gestational diabetes who have effectively brought down their A1C. We'll go into that a little bit later. health and wellness consultations. We have our machine for body composition. It's the eVolt 360 Body Composition Analyzer. This has been a really popular one for those who want a more detailed review of their body composition and what exactly in their body needs improvement. Okay, we have disease management, in which we coach over hypertension, basically the non-diabetes chronic conditions. Okay, we also have a type 2 diabetes prevention program, or the Prevent T2 program. And we also refer to the quit line. So we do the quit now smoking cessation or nicotine cessation. Then we have online, if you've seen our YouTube channel, a partnership with Rose Shandor at Payless Supermarkets and the Edge Kitchen. And that's our Eat Right cooking demonstrations, which have been really fun. I get to enjoy those every few seasons. And then we have, of course, our group fitness classes, which are free classes for our Take Care members at different locations. We have the Hilton location, we have the Century Plaza, Zumba and Mixed Fit, and we also have Urban Fitness. Okay. So this is the flyer available for our DSMES program. You can see here that we've promoted it with the participants reducing their A1C by 1 point in 2025, and this was also shown for the results of 2024 as well. This is open to the public, so I want to make that clear because while we do have, of course, our members, our Take Care members that we want to catch, right? We also understand the need for diabetes education in the community. So we have the one-to-one consultations available for the Take Care members, but we do group classes. We've done a total of 9 sessions this year and in 2024, and in 2026 we're hoping to catch a little bit more of the community that isn't covered with Take Care, so to the public, right? And we have these available at the FHP Annex. And you can see here, starting March 11, 2026, this will be our first session. If you'd like, you can take a picture of this and promote it to your members. But also, we have these available during our health outreaches. And you can see the topics as well that we'll be covering along with this schedule. There's also a QR code here if you want to refer members for this program. So this is a little bit of an overview for our eVolt 360 Body Composition Analyzer. It includes the eVolt 360 Body Scan. It's very useful in tracking and monitoring progress. The initial is really cool because you get all the information about your body. And I know we have a few people in here who have taken advantage of it, and I've always gotten good reviews from it. But again, really cool to know about it, even cooler to see your progress, how different lifestyle changes really make a difference in improving your body composition and in how it affects negatively, right? Like how your choices negatively affect your body composition. There is an included calorie and macronutrient profile depending on what your body goals are. There are 3 different goals. We have muscle gaining, fat loss, and overall better health to maintain your current health. And then supplement recommendations, while being clear that we always encourage a food-first approach, and then, of course, to discuss with your provider if you decide to include supplements in your routine. This is a little bit of the background of what you get on the app. So this is for members available on their own. You can see that this member has 223 scans. You can see their completed supplement profile, and you can see here the details. It's a little blurry, but we do have the details of their body composition here as well. And these little indicators in green, red, and gray are positive improvements, negative improvements, and then things that have not changed. In their body composition, the segmental analysis is where the distribution of that body fat and lean body mass is. And those, again, who have joined, who have done it before know that terminology well. So going back onto our participation and outcomes, in 2025, from January to November, we had 789 members utilizing our wellness program. So on a monthly average, 66 members, and on average, there were 4 visits per member. So this is on average, right? We've had some members who have continued their wellness checks with us on a bi-weekly, monthly basis. And then and those who have completed our programs for nutrition consultations, our diabetes management, have completed the 4 sessions for those programs as well. Our most utilized service is the DSMES program, nutrition education, and the eVolt 360 body composition analyzer. We did 393 scans in the year 1990. What am I saying? In the year 2025. You can see that the total fat loss among these members was 478 pounds, and muscle gain was fat loss was at a loss of 478 pounds, and muscle gain was at 252 pounds. So this was really impressive amongst our members, and we had also seen that people who were monitoring their body composition more closely were also more likely to see positive results. So for DSMES, you can see here the program outcomes, and A1C had been improved by a total of 1 point. Here, weight had been improved among at 175 pounds. We'd had improved BP for diastolic and systolic numbers, and you can see also the results for cholesterol and triglycerides. So we're going to do a case review for one of our members. This was a 39-year-old female who had participated in our nutrition education program. Her goals were weight loss overall, fat loss, improving general health, and reducing her risk for type 2 diabetes. So she had not yet been diagnosed with diabetes, but had been diagnosed as pre-diabetic. Her plan was to exercise 3 times per week, increase fruits and vegetables, moderate protein and carbohydrate intake, but also to practice portion control. Her results over 4 months, from April to November, were a total of almost 25 pounds of weight loss and 13.5 pounds of fat loss alone. So this improved her visceral fat by 1 pound. She did start Ozempic in July 2025, but you can actually see that she had done, or I saw that she had done the work within the first 2 months and had lost 10 pounds on her own and then had plateaued. So of course, discussing with her doctor, had decided to include the use of Ozempic. So, and this case review was for our DSMES service. This was a 60-year-old female with type 2 diabetes, and she had enrolled in the DSMES program in 2024. You can see actually at the bottom here that she had come in 2024 and maintained an A1C of 8.8 from August to November. She had discontinued after November, and you can see that her A1C had actually risen. And once she had returned to the program, was able to reduce her A1C by 0.5. Okay. Her goals were hypoglycemic detection and management, taking medications as prescribed, education on eating less carbs and how to do that, improving her understanding of the factors that influence her blood sugar. Okay. And again, the less frequent visits from November to February 2025 had shown that it was a struggle for her to manage that, and that the program had very much supplemented her, her journey successfully. Help. One moment. Oh, the eligibility requirements are for active Take Care members at the time of participation. So once they are not a Take Care member anymore, their eligibility is expired, right? Programs are exclusively for Take Care members unless otherwise specified, like for our DSMES group session, which is open to the public. Okay, and we have open access to the diabetes DSMES monthly group sessions, cooking demonstrations, and virtual education sessions. So the Eat Right workshops are also available on our YouTube channel, along with the many recipes that we've prepared over the years to encourage that healthy eating pattern. Next slide, please. So for the scheduling and referral process, this is our Take Care Wellness website, at which you can start a referral for the member, or they can schedule on their own. Okay, our phone numbers, the 646-6956, along with our extensions, that is for me and Ernest directly. And our fax, if you need it. Our email is wellness@takecareasia.com. So I think there will be a small little demo on how to access the referral, or to how to start the referral process on our website. And that's right here. So you can see the scroll down to submitting a referral, so this is for providers, and if not, a member could just select the Book Now button and continue the booking process that way. So yeah, this will be directly to wellness, yeah. So for us to reach out to them and to do scheduling and changes would be directly through this website, yes. And for 2026, we do have our Livongo by Teladoc Health. This is a one-of-a-kind approach to condition management. Okay, participants have access to connected health monitoring devices, certified health coaches, and support from mental health specialists, all to help manage their conditions like diabetes, hypertension, and for those with weight challenges. We also have a partnership that will be expanding with Fit For You Guam, and they are a meal prepping service. So bigger discounts to come then. And please enjoy this short video that we've prepared for you.
Ready to take control of your health?
Today we are on site at Tsubaki doing the health fair.
We're here at the Leo Palace Resort Guam, attending the Guam Fit Expo.
I do health education and nutrition counseling with the wellness team at Take Care.
Thanks for Take Care. Thanks to our whole entire community of family members that help support us.
In for 2025. Okay, so that is all for the wellness programs. Going forward, we have this video by Donabel Little. She is our clinical quality manager, and we'll go ahead and continue with that video now.
Good evening, everyone, and thanks for being here tonight. I'm sorry I couldn't be there in person, but I hope you're all having a great time. I won't keep you long, so let's get right to it. Tonight I'll be sharing some updates on our clinical quality improvement program. First, Take Care has received the renewal of its accreditation from the Accreditation Association for Ambulatory Healthcare, or AAAHC. This extends Take Care certification through the year 2028. As a testament to the quality of services we provide, Take Care achieved a full 3-year health plan accreditation by AAAHC beginning June of 2016, making it the first accredited health plan in the region. Accreditation validates Take Care's compliance with national standards for quality healthcare delivery, patient safety, and operational excellence. AAAHC, a private nonprofit organization established in 1979, accredits more than 6,000 healthcare organizations nationwide through peer-based evaluation process. State and federal regulators recognize AAAHC standards as meeting requirements in quality management, patient safety, network adequacy, and provider credentialing. When the AAAHC auditors were here, they examined Take Care's operations across several areas, including members' rights and protection, governance and administration, provider network credentialing, network access, availability and adequacy, case management and care coordination, health education and wellness promotion, and quality and risk management programs. This renewal reflects TakeCare's continued commitment to meeting the highest benchmarks in healthcare quality and member services. The rigorous accreditation process ensures our members receive care supported by systems that meet nationally recognized standards. And also this year, we are filled with gratitude to have been recognized once again as the island's best medical insurance for 4 consecutive years now. We take great pride in serving the community and thank you for trusting us to be your partners. As part of our quality management program, TakeCare assesses service performance metrics like call abandonment rate, call answer timeliness, first contact resolution, prior authorization timeliness, and the turnaround time for a provider credentialing application. Our metrics for 2024 is aligned with existing national benchmarks established for these measures. As you can see, our call abandonment rate is at 4%, well below the 5% benchmark. Our call answer timeliness is at 94%, well above the 80% benchmark. The first contact resolution is at 92%. Our prior authorization, which is the average number of days to render a prior authorization decision, is at 1.5 days. And our provider credentialing turnaround time is at 16 days, well below the 30 days benchmark. For clinical performance metrics, we looked at HEDIS, which stands for Healthcare Effectiveness Data and Information Set. This is a resource that help us use to evaluate performance in key areas of care and services. It features more than 90 measures spanning different domains, allowing consumers to compare how health plans perform and monitor advancement in healthcare quality. So as you can see, we continue to struggle with improving preventive cancer screenings, which are below the 5th percentile benchmark based on the national benchmark. And this is also consistent with similar health plans on the island. Our ratings are just lower, much lower compared to the stateside rates. You can help us by applying some of the best practices to close these care gaps by educating your schedulers to review the needed screenings, tests, and referrals for your patients. Discuss the importance of preventive cancer screenings with your patients and assist them with scheduling tests and follow up to ensure they complete the ordered screenings. And under treatment for the measures for cardiovascular measures, controlling blood pressure, and statin adherence, TakeCare's rates are at the 61st percentile mark and 12th percentile mark compared to the national benchmark. And also compared to similar health plans on the island, we score higher than our competitors' rating. For diabetes control, TakeCare also is on the 23rd percentile mark, and it is also higher compared to our competitors' rating here on the island. We tend to score higher on these measures, and I credit our comprehensive wellness program that's in place. So we ask you to continue to refer your patients to TakeCare's free wellness programs. We have our diabetes prevention program, diabetes self-management education support program, or DSMES. We have a hypertension case management program, nutrition education, and fitness consultation. As part of our quality improvement program as well, we not only focus on the clinical quality and effectiveness of care aspect, but we also look at patients' experience for the care they receive. So each year, TakeCare conducts a member survey. We partner with Press-Ganey, a national committee for quality assurance, or NCQA certified survey vendor, to conduct the Consumer Assessment of Healthcare Provider System, or CAP survey. This is developed by the Agency for Healthcare Research and Quality, or AHRQ. This is a random of sample of Take Care members we surveyed to rate the services they receive based on the healthcare needs, their experience in the receiving the care, and the perception of the service quality provided. So compared to last year and this year, overall the ratings from these distinct measures have positively increased apart from the coordination of care. So all of these measures, health plan, rating, getting needed care, rating for health care, getting care quickly, how well doctors communicate, their rating for their personal doctor or primary care doctor, the rating for specialists, all of those measures have improved from the previous year. And again, for coordination of care, it declined by a few points. So we face a unique challenge here in Guam with limited provider network and access to specialty care on island, which we will need coordination of care off island. There are opportunities to be made here by submitting timely off-island referrals, as well as utilizing telehealth services for services that are not available on island. And speaking of network access and availability, in alignment with Take Care's quality management, we have established and maintained standards for network access and availability to ensure that healthcare needs of our members are adequately addressed. We conducted a survey that focuses on providing access to a comprehensive network of primary and behavioral health providers. So we just did the survey a few weeks back. And based on so far the responses that we've received for behavioral health, based on the survey, 33% of our behavioral health providers are not accepting new patients, and none of them actually have availability within 10 days. And for primary care, for those that have responded, 100% have indicated that they are accepting new patients. However, 43% do not have availability of appointments within 10 days. And also 20% have availability of more than 14 days out. And also every year, we ask you to complete a survey about the experience you received with Take Care. Take Care partners with Press Ganey to conduct the survey. And your opinion is very important to us, and we are eager to use your feedback to help direct operational changes and to point out areas that need improvement. Our top concerns that we are focusing on this year based on the responses we receive are in the areas of finance and claims reimbursement, pharmacy network, and health plan call center support. This year's response rate was at 17%. It is an increase from last year by 2% based on a sample size of 405 providers. This includes providers and clinic managers. So if you have completed the survey, we thank you for your participation. To promote a greater participation this year, we are having a raffle drawing, which will be awarded in tonight's event. A prize will include a one round-trip ticket airfare to Japan. So again, we do appreciate you completing those surveys. Those surveys are very important to us. It does help us with our quality improvement program. So with that, I will turn you back over to Giana and the rest of the Take Care team so they can draw the winner. And again, thank you for coming to tonight's Provider Dinana. And I look forward to seeing you all soon when I'm in Guam and in our next event. So happy holidays, everyone. Have a great evening.
And a round of applause, please, for Miss Donabel Little. Okay, so before we get into our exciting raffle, I'd like to invite Zhen up to give you guys some updates.
Good evening, everyone. So today we just sent an email blast to all medical and dental providers. And if you are submitting EDI claims, there's going to be a new it's a revised EDI companion guide that we send out today, and we ask that you coordinate with your clearinghouse or whoever is doing your EDI claims, because it's very important. Effective January 1, 2026 is going to be rolled out, and the main change to this is how you put your member ID. So the member ID should be in the proper EDI segment or loop. Initially, it's been instructed to put it in 2010 BA, but the 2010 BA is meant for the subscriber, not the patient. The patient has to be on 2010 CA. So once this is rolled out and you still put it on 2010 BA, it will automatically be rejected by the system. So that's the standard way of doing or submitting the EDI, is putting the correct member or patient ID on the correct loop or EDI segment. So that's pretty much what's going to be happening on this rollout. So this is in line also with the transition to the new system. We have been constantly tweaking all the issues that we've been encountering since this transition. And this is one of those that we've noticed a lot of rejected claims, because it's trying to find like a layer and layers of protocol on how to find the correct member. So even if you're submitting the correct member ID, but because it's in a different segment, which is meant for the subscriber and not the patient, then it gets rejected. So this is very important. So we are also going to be reminding everyone again through the email, and also going to be on our website, that that in order to prevent this rejection of claims, that it has to be fully complied with this new revised companion guide. So there's an emphasis on which ones are revised. So please communicate that to your billers, to your EDI clearing houses. So that's very important. And I know that everyone's wondering about the new provider portal, and we are in the final stages of testing it out. We have come across some hiccups about the accumulators of our members. So it's not reflecting what's supposed to be. So it's in the final testing phase. So we don't want to roll out something that's wrong. So we're hoping, I'm shooting for early 2026, hopefully by January, but just to be safe, just during the first quarter of 2026. So, but you can still use our current provider portal, which is a TC EVA. Otherwise, there's also customer service to reach out to if you are unsure of the if the member has reached out of pocket. So that's pretty much what's happening on this side of provider relations. Thank you. Giana?
Okay, and now for all of our real favorite part of the presentations, we do have our raffle drawings. And maybe second favorite part, because I heard the menu was really good. Really looking forward to it. Anyways, going forward, we will be giving away $10 of Skechers gift cards, and this is going to Miss Yvonne. Congratulations! Where are you, Miss Yvonne? Raise your hand. Oh, there she is, right at the, okay. Congratulations, Miss Yvonne. We will also be raffling off 2 Evolt 360 body composition scans and 2 $50 Vision gift cards. Okay? So for the first Evolt, this is going to, drumroll please. Miss Connie, congratulations. She's so lucky every year, every time. Congratulations. What was that? Congratulations. You're going to come, right? And the second one going to Mr. Tim Twido. Okay, so now going on to the FHP Vision $50 gift card. This is going to, congratulations to Mr. Mrs. Temper. Mr. Sorab. Oh, congratulations. Round of applause, please. Thank you. And so last one before our grand prize is announced. Mr. John Titano. Dr. Titano? Oh, no, there's two. This is a trick question.
Sorry, so the ticket.
Oh, ticket number. Let me just verify. Is 380-309. 380-309. Congratulations. I was rooting for you. Okay, and our grand prize is, what is the grand prize?
So the provider satisfaction survey, it's a round trip.
Is the round trip ticket to Japan. And this again was the provider survey winner, Mr. Alex Shanae. Viva! Round of applause! Congratulations! I was rooting for you. I was rooting for all of you. I'm sorry. Okay. And for closing remarks, congratulations to all the winners. And then for closing remarks, I'd like to invite up Mr. Francis Santos. I call him my stepdad at work.
This is Giana, my ex-wife.
Oh my God.
Just teasing. Actually, I used to work with her mother-in-law, right? Way back in the day. I was teasing, the politician in me always likes me to talk, right? Anyways, I wanted to tease my potential candidates, Dr. Wah and Dr. Shea, as our potential candidates for, because we need a healthcare advocate, right? So, just kidding, Doc. You know, I gotta put it out there, you know that. But anyways, I have to make a pitch because my boss is there, George Chu. How did you think, did you like the food? Thank you very much. So we want you to come back. This is the Crown Terrace Plaza. You know that? So they're having a wonderful promotion for Christmas, and it's on the tabletop and stuff like that. For those of you, I come here for breakfast normally, not dinner, so I get to really judge the food tonight to say that. So on behalf of they want me to stand here. I'm better right here. Anyways, on behalf of the Crown Plaza, George, they like the food, so we're going to welcome them all back. Okay. Hi. Anyways, again, I want to thank Zhen. Please stand up, and your staff from the provider relations side. And we do want to thank you for your patience because we are struggling with this new system that we put on. Okay? And it's you know, I know Zhen colors her hair all the time. And I tell her, you gotta stick it out because it's something we need to do. That's me, right? That's okay. All right, so since you don't have any more questions, I was asking Zhen, when do you think we're going to come back? So hopefully at the end of Q1, when we can really say our provider portal is going to open up and open us up to the world, okay? So I'm going to watch Zhen and get on top of that. But on behalf of George Chu, Zhen, our provider relations, our wellness, and our whole team, thank you. Happy holidays. Merry Christmas. George, anything else? Okay, George wants us to go home now. There's plenty food. Please eat. Okay, thank you. Please eat more.
The buffet is still open, so please enjoy yourselves and eat until you can't eat anymore.
Thank you again.
Really quick before everyone leaves, just a reminder for the provider survey. Here's the QR code in case you need it. Otherwise, thank you again. Have a great night and drive safely, please. The holiday drivers are out.